So, hair fall, everybody dreams of having a beautiful hair. But now, with the modern lifestyle, what we are living in, it is not less than a dream. So, I'm Dr. Nandini Sunkireddy. I am board certified in family medicine, lifestyle, and obesity. I have Dr. Kimi over here who is going to talk a little bit about hair fall and what we can do and to prevent it and what are the evidence-based recommendations. So let's welcome Dr. Kimi. And Dr. Kimi, thank you for joining us today. And if you can talk a little bit about, tell a little bit about yourself.
Thank you for having me. I'm a board certified dermatologist and I'm also a lifestyle medicine expert. I'm passionate about pretty much all aspects about dermatology, and hair loss is a particular passion of mine because it affects so many of my patients and some of my family members. I've had different forms of alopecia. I'm also really passionate about healthy living. I'm actually the author of a book really quickly called Live and Look Younger. And this
Wow.
is relevant because whenever we have fuller hair that's not as gray, we look younger. So I love addressing hair loss and helping my patients do what they can to reduce unnecessary hair loss and have healthy, full hair. So thank you for having me here.
Thank you so much, Dr. Kimi. And Dr. Kimi lives in Houston, and she is going to talk a little bit about it. So I'm a primary care physician, and I would say like more than 90% of the people who come to me complain about hair loss. It could be women or men. So it's more than 90%. So it's more of a problem than what we expect. So, Dr. Kimi, tell us about like how common is this hair fall?
All right, well, it doesn't surprise me that so many of your patients are complaining about that
Mhm.
because it's exceedingly common. So, and I'm sure we'll go into this a little bit later. There are many causes for hair falling out, for hair loss, and some of them, the most common that we see is what we call androgenetic alopecia, where there's a hereditary pattern to it. And for men, usually with the androgenetic alopecia, we start seeing the hairline receding at the temples, and we have the common balding. It can also affect women. For the women, the hairline remains the same, but then you notice that when you part your hair, that there are increased hair spaces and the hair just feels thinner. You can see the scalp more. It's really, really common in the US. It's estimated that 50 million men and 30 million women have androgenetic alopecia in various forms. So it's by far our most common, and the reason, probably one of the leading reasons why a lot of your patients are complaining about it.
Yeah, I have some patients tell that like they're scared to take go into the shower because of the hair fall. Like I mean, they're just looking at their hair and they just go like I mean crazy about it. Yeah, no wonder it's so common.
It's
And
extremely common. And also, just when
yeah,
it comes to hair fall, let the patients know that it is normal to lose about 100 hairs a day. We
right.
have about 100,000 hair, 100,000 strands of hair on our head. And there are three phases of hair growth. There's the anagen, where most hairs are. That's a phase that can last for years. That's when it's growing. Then there's catagen, which is when the hair stops growing and the hair follicle separates from the root. And then telogen is the last phase where the hair rests on the scalp for about 2 to 3 months and then falls off. So if they lose
Mhm.
about 100 strands, that's normal. They should not freak out. But if they're losing more hairs, if they're losing hair faster, then the hair replenishes itself. That's when we notice the thinning, and those are the types of alopecia that we have.
Yeah, thank you so much for sharing that. Like because that's kind of reassuring for most of us,
Yes.
definitely. And tell us about like what can we do to prevent it, or what kind of lifestyle changes we can do to prevent this hair fall.
Perfect. So the important thing whenever you're having more hair fall is to first have it diagnosed. And that's where your doctors come in. Definitely start with your family doctors like yourself. You're very
Mhm.
knowledgeable in that. Or you can come to the dermatologist because again, there are many causes of hair loss and hair falling out faster. There's the androgenetic alopecia again, which I mentioned, that's the most common. That one is kind of genetic. If you have the genes where you are destined to have it, there's really not much you can do. You just have to love
Mhm.
it and accept it. Of course, there are things you can do to slow down the quick progression, but we can't change our genes right now. And then there's alopecia areata, which is an autoimmune type of hair loss where your actual white blood cells, a type of white blood cells, is attacking the hair follicles. Usually with that, you'll see kind of circles. You'll see an area of the scalp where the hair falls off, where it's very localized in one area, or it can be everywhere. There are many different presentations, but that again, because it's an autoimmune process, that can be treated medically, and you should go to a doctor for that.
Right.
And then you can also have hair loss from certain medications that cause hair to fall out more quickly. Whenever if you have deficiencies of certain nutrients like iron deficiency or vitamin D deficiency, that can cause hair loss. And then also thyroid, if you have thyroid anomalies, either hypothyroidism or hyperthyroidism, that can also cause hair loss. So, and also if you have anemia and other chronic diseases.
Mhm.
So it's really important first to find out what your cause of hair loss is. And for all the listeners, it's nice to listen to a video and try to take the tips from it. But remember, get it diagnosed first so that you're not delaying care. Because I also haven't mentioned the more rare autoimmune types of hair loss where there's scarring and where the white blood cells attack the hair follicles, and if that process goes on for too long, it causes scarring of the hair follicle and it can be permanent. So it's always best to just have it diagnosed first before you go into the treatments.
Wow, that's awesome. And what kind of diet can they, because I get this question a lot, like what are the diet changes, what we can do like to prevent hair loss? And I mean, are there any supplements we can do, or are there any other things what can we do diet-wise to prevent hair fall?
So that's an excellent question. In general, if you have a healthy diet, you should be good. But in general, we want you to have good quality sources of protein because you need protein to build for the hair generation to build up that keratin. So you need some protein. You also need your vitamins. You want a nice healthy mix of vitamin C, vitamin A, vitamin B. You definitely need vitamin D. And you also need minerals like zinc, iron, and selenium. You also need good fats, foods rich in omega-3 fatty acids. So if you can have a mixture of good protein, vitamin A, B, C, D, and then the zinc, iron, selenium, and omega-3 fatty acids, that's a good recipe. And that's a good those are the nutrients that you need. And in general, if you have a nice whole foods diet of more natural foods as opposed to
Mhm.
processed foods, they tend to retain more of the nutrients that you need that will sustain not only healthy hair but a healthy skin and a healthy body.
That's awesome. And how about these supplements, biotin supplements? Like, do you recommend them or?
So I feel like biotin is probably one of the things that has the best marketing in the
Mhm.
world because most of my patients with hair loss come taking biotin. So biotin is one of the B7 vitamins, and it's been shown to really help with the nails. It'll help your nails grow faster and thicker. When it comes to hair, it's actually hyped up. It helps a little bit, but not as much as people think it does. And so whenever I see people with hair loss coming with biotin supplements, I actually discourage the use. If they have a good quality multivitamin, they have enough biotin. And actually, the reason why we discourage biotin, I'm sure you're telling patients that all the time, is that biotin can affect lab studies. A lot of the labs that we do, they use some biotin. Well, I really don't know how to describe it, but then some of the reagents rely on a biotin like substance to process them. And so if you take biotin supplements, you can change your lab results. And the biggest ones are the thyroid studies.
Right.
So if you have thyroid issues and you get in thyroid labs, you definitely want to stop your biotin intake 7 to 10 days before the lab so that it doesn't mess up your labs. And then also heart attacks. Whenever people are having MIs and they go to the emergency room, if you're on biotin supplements, it can affect those labs and make it look like you're not having a heart attack when you actually are. So even though biotin is used, it can help a little bit, we usually tend to discourage that. We prefer vitamin D, vitamin C, the omega-3 fatty acids, and not really biotin.
Yeah, thank you so much for demystifying it. I mean, I get this question every single day about biotin. So I have to, in fact, stop them from taking biotin at least for 7 to 10 days before we could do the blood work. Yeah, you're so right on that.
But it's
And
excellent for nail growth if they have thin
yeah,
nails, but they just have to remember that. And then again, the zinc will be helpful, selenium will be helpful,
right.
iron, especially if they have anemia, will help a lot with hair. Because if you have anemia, your body is struggling so much, it's not gonna generate the iron that you need for hair growth. If you have anemia, it's not going to be put into that end because hair is more cosmetic even for the body. So for our anemic people, for sure, make sure you're getting your iron in.
Right. Yeah, we do check the ferritin levels and iron levels most of the time. Yeah, that's so informative. And I have this question, like, I mean, I'm sure you got this question. There are a lot of like shampoos are in the market, a lot of hairsprays in the market. They promise the moon and the roof. So, I mean, if you have hair fall, use this shampoo. If you have hair fall, use this hairspray. So, how reliable are these?
So, unfortunately, the FDA does not regulate products like that as much and their claims. And so, some of them may have some oils that help to strengthen the hair shaft, and that's why it seems like it's causing hair growth. In general, in terms of things that have been scientifically proven, minoxidil is a topical ingredient that has been studied and we know that it will help you out. So if you have a foam that has minoxidil or a solution that has minoxidil promising hair growth, it will help to speed up the process of hair growth. Minoxidil, before it was over the counter, was a medicine that we used to prescribe, and we know that it helps with hair growth. For some of these other molecules out there, again, some of them it's just marketing, some of them there's some truth to it, but in terms of evidence-based, minoxidil is the one topical ingredient that dermatologists and physicians will recommend wholeheartedly because we have a lot of data backing its effectiveness. The one thing, though, that you have to remember about minoxidil is that it's a supplement that promotes stronger, thicker hair growth. But just kind of like, just like when you water a plant, when it gets used to the water, it's nice and lush. But then if you stop watering it, the plant withers. That's kind of the same thing with the hair. The minoxidil does work, but unfortunately, just like watering a plant or feeding yourself, you have to use it every single day consistently, or at least every day or as close to every day as possible for the sustained benefit. If you stop using it, things go back to the beginning, just kind of like a plant. If you stop watering it, it forgets that you watered it several months ago and it withers and dies. So same thing with minoxidil. If you do use it, it will work, but remember it's a commitment. And so before you jump into it, remember that it should be a commitment. And if you're not willing to commit to it, probably don't use it because you'll use it, you'll get thickening and you'll get fuller hair and you'll be happy with it. And the day you stop using it, you kind of go back to square one.
Yeah.
So it doesn't make you lose the hair any faster. That's a myth out there that it makes your hair fall off. It doesn't make you lose it any faster. It's just that a lot of people who were on it got so used to the nice full thick hair that when they stop using it, it's shocking when the hair goes back to square one and the drastic difference makes them really miserable.
Yeah. That's so that's incredible. So yeah, my last question for you is like when do you recommend like seeing the doctor? I'm sure you mentioned those points, like we'll just highlight those. So when do you think like I mean it's like necessary, okay, we need to go to the doctor?
So if you notice very rapid hair fall, then you want to go to a doctor, especially if you have symptoms like severe itching or burning pain. And especially the burning pain, that's more of a hair emergency because it could be a sign of one of the inflammatory autoimmune type diseases that where the hair follicle is really being attacked quickly and you'll want quick medical intervention. So I'd say if it's very rapid, associated with symptoms, you want to get seen. If it's just happening a lot and it's very drastic and not gradual, you want to be seen. If you have chunks where the hair is lost, where there's baldness, then you also want to be seen for that. But if it's the general androgenetic alopecia where you see it, you see the patterned hair loss that's in your family members, if your uncles and parents have it and you have it too, and it's gradual, that's probably androgenetic alopecia, and that's when you want to do the lifestyle intervention. We mentioned diet, it's really important. Stress control is another really, really important thing too, because whenever we're stressed out, our hair is just not as healthy and we can have more hair loss. So people should learn stress control. I know you're really good at that, and so I'm sure they'll be learning a lot more of that from you.
Right. Yeah, we have a doctor who's going to talk about stress next session. So yeah,
Excellent.
definitely stress can make a lot of things go wrong.
That is so true.
Yeah, it's so informative. Thank you so much, Dr. Kemi. And tell us a little bit about your book.
Yeah, so my book is called Live and Look Younger. It was released a few months ago, and it's pretty much a dermatologist guide. It's my guide on how people can just reduce signs of premature aging and actually even reverse signs of aging. And pretty much in the book, I divided to several sections. In the beginning, you learn all about aging, the causes of aging that you can prevent yourself, and the causes of aging that you can't reverse. The book also goes into skincare and how you can select the right skincare regimen for you. It also goes into anti-aging ingredients and the proven ones. And then it also talks about lifestyle changes to delay premature aging, like diet and exercise and sleep. The book also goes into cosmetic procedures that you can use to reverse aging. And then at the end of the book, there's like a 6-week anti-aging plan that most people can adapt and use to allow them to age more slowly.
Wow, I'm gonna buy it today.
Oh, that's
I'm gonna
awesome.
order it
Thank
from
you. I'll put
Amazon
it up here in
today.
case your
Live and
viewers
look
want to buy it.
young.
Live and Look Younger. And you can find it on Amazon, or you can go to www.drkemibook.com. That's KEMMY book.com to get an autographed copy from me.
Yeah, I would definitely order one for
Awesome.
myself.
Thank you.
So, thank you for listening. Thank you for Dr. Kimmy for telling our viewers so many good things, and thank you for demystifying about the biotin. And so, this is all we have today. And thank you for listening. And don't forget to subscribe to my Facebook group, Style Your Health MD. And you can always, if you have any questions, I won't be able to answer any personal questions, but you can always, any topic, if you're interested for me to bring it to light, like you can always email me at styleyourhealthmd@gmail.com. So we'll see you next week with another different topic. So just stay tuned to Style Your Health MD. Thank you.
Bye.
Bye.